The group that we represent here is the Heal Ukraine group, which have members below, including these doctors and scientists working together to provide aid and information and educational materials to Ukrainians on the front line in the war currently. I would just want to emphasize to those on the call the scale of what is going on. Russia launched an unprovoked invasion of Ukraine, its neighboring democratic nation, on February the 24th. And as you can see from the report from the Institute for the Study of War, where the front lines now are in eastern Ukraine, you can see that these are just colored areas that have been occupied now by the Russian army. But these military maps also belie the enormous scale of suffering that's going on underneath that sort of pale pink color, and also beyond into Ukraine and beyond the borders of Ukraine into neighboring nations like Poland and Romania, where there's been great influxes of refugees. So the scale of what's going on is to a former sovereign nation of 44 million people that has been invaded and now is suffering vast consequences to its populace of what is happening there. And these are the numbers. I include the ones from June the 8th, 2022, just up in the left-hand corner there to give you the scale of the refugee situation reported from the UN, and then in the larger numbers, what these have grown to since June. You can see from 4.8 million to 6.4 million refugees from Ukraine. Border crossings from Ukraine and other countries have all increased. These numbers are staggering in their scale and consequently have enormous impact on healthcare maintenance, and both in Ukraine and in the neighboring countries. So really underlie the severity of what is going on in Ukraine itself and the invasion by the Russian army. And then the latest reports that I could pull up, not from May, I'm sorry, I should have updated that. This is from this month, both by WHO and Fox News, reporting between 434 and 869 attacks on healthcare facilities, 79 deaths of healthcare workers and patients, and multiple alleged violations of Geneva Conventions and other war crimes, civilians' deaths, looting of property and produce. We hear about regularly about the wheat and shipping of food products from Ukraine being blocked by Russia, mass killings, mass graves, targeting of civilian infrastructure, rape used as a weapon of war, is so-called an ominous filtration camps, forced deportation, ongoing war crimes investigations, and then most recently in The Guardian, a report on cremation centers in occupied Ukraine, where bodies of both Russian soldiers and Ukrainians are simply cremated. None of this, obviously, in the history of warfare is new. And if we'd been here in the 1940s, all of these things were occurring, and we're aware of the depravities of armies in this type of situation. But these are being reported on, and why we gathered the speakers we have today is in order to inform you as best as we can about the situation on the ground from eminent speakers that have really been organized to speak today about these issues. I'm going to unshare my screen and introduce Dr. Nelia Manichuk, who without her involvement wouldn't have been able to put this together through her network in Ukraine. Nelia, take it away.